I'm Sue Matthews. I'm the CEO of the Royal Women's Hospital, and I say no to violence against women. The Women's has a vital role in the prevention of violence against women. We've been protecting women and caring for the most vulnerable women for over 160 years. We know that 30% of women experience violence in their lives, and those are not just patients, but they're also staff. So the patients, the women that we care for, we run our program called Strengthening Hospitals' Response to Family Violence, and that helps staff to identify and sensitively inquire about family violence and the risk of that for women. And it also helps them to know what to do when a woman discloses violence. But we also look at the staff, and 85% of our staff are women in healthcare, and if 30% of women are experiencing violence, then 30% of that 85% is experiencing violence too. So we have a program that we run for managers to also look at the triggers and the tools and what are those signs and symptoms that they should be asking sensitively of their staff, whether they're experiencing violence. And then what do we do when a staff person also acknowledges that they have experienced violence against themselves, and how do we create an environment that is safe for them to disclose it, but also safe for them to come and work in. I think that's probably the key factor in what we're doing, is the caring for our staff and our patients. I think in the future the Women's should continue to be a leader. We should continue to support all the hospitals across the state and other healthcare organizations in determining and supporting people who have experienced and are experiencing violence. We've been working to support women who've experienced violence for over 160 years, and we'll continue to do that until violence against women is eradicated. I hope it doesn't take another 160 years, but as long as it takes, we will continue to provide leadership in this area. I encourage each and every one of you to take a stand against violence against women.